So I'm executive director of Environmental Health Trust, and we're a scientific think tank focused on publishing research, raising awareness on science-based measures to prevent cancer and other disease, focusing on environmental health issues. I know that you're familiar by now with our lawsuit against the FCC, where we challenged their decision not to update the FCC's 1996 limits for human exposure to radio frequency radiation. So in 2021, when the FCC was deemed by the U.S. Court of Appeals for the D.C. Circuit as having been arbitrary and capricious in its refusal to update the U.S. FCC limits, which were set in 1996, the court found that the FCC had ignored record evidence, including the impacts of long-term wireless exposure, because there has been no report by any federal agency reviewing the impact of long-term exposure, especially to children and in the new 5G environment. The testimony of people injured by wireless radiation, impacts to the environment, and non-cancer impacts, impacts the developing brain and reproduction. Now, the FCC was mandated to establish a reasonable record of review of the evidence and to address issues that it had ignored, like children, long-term exposure, and so forth. But so far, the FCC has not responded. So in my packet, and I can send you a online one that has links to everything that is listed in there, we address how the FCC limits and the case of cell tower radiation really exemplifies the concept of a regulatory gap. There was no pre-market safety testing for long-term damages from non-ionizing radiation exposure by any federal agency, certainly not on up-to-date science. There is no post-market surveillance for health effects. There's been no risk analysis for long-term effects, yet there's an ever-accumulating body of independent science showing harmful effects, biological effects, adverse biological effects at levels that are in FCC limits. I also have in the packet page on various setbacks of different municipalities around the country that you have in front of you, like Shelburne, Massachusetts, 3,000 feet for schools and 1,500 for homes. Copake, New York, 1,500 feet, homes, schools, churches, and public buildings, and so forth. But what I really wanted to address was some of the information that's been presented that makes it seem like our federal agencies have, in fact, opined or had an opinion about whether radio frequency radiation is safe or not. First of all, the FDA has no authority in regards to cell tower radiation and has not reviewed the totality of evidence, at least in any public way that we're aware of. And just, I have a quote in the packet where a mother wrote to the FDA, and actually we have several responses from the FDA at this point, and she requested safety data on the small cell that was right in front of her. And the director of FDA Office of Policy Center for Devices and Radiological Health responded, the FDA does not regulate cell towers or cell tower radiation. Therefore, the FDA has no studies or information on cell towers to provide in response to your questions. There's a Pittsburgh Law Review article entitled Why Radio Frequency Radiation Standards Have Failed to Keep Up with Technology that concludes the FCC and FDA have failed in their obligation to prescribe safe radio frequency radiation guidelines produced from wireless communication devices to protect the public health and safety. So what about the CDC? Well, there are no scientific reviews by the CDC on wireless radiation that evaluated the science in any systematic way, or in any way, actually, that we're aware of. In fact, our investigations found that the CDC hired a consultant with longstanding wireless industry ties to serve subject matter expert on their pages on non-ionizing radiation and wireless wearables. And we have all of that on our website, and I also link to that. The National Cancer Institute. There are no scientific research reports by the National Cancer Institute that exist regarding 5G cell tower or even cell phone safety. And I myself contacted the National Cancer Institute in 2016 because I had been told by my municipality that the NCI somehow supported the limits or had reviewed this issue. And they responded back to me that their literature review, neither the literature reviews or the fact sheet make safety determinations. And of course, the New Hampshire 5G Commissioner Denise Ricciardi got a response back from the National Cancer Institute most recently, and I'll quote, "The NCI is not involved in the regulation of radio frequency communications infrastructure devices, nor do we make recommendations, policies related to this technology." Now, the American Cancer Society also has cited as somehow supporting FCC limits or saying that all, providing safety assurances. But this is not true. The American Cancer Society states very clearly that they don't have an official position or statement on whether or not radio frequency radiation from cell phone, cell towers, or other sources is a cause of cancer, and that's on their website. And they have not done any kind of review related to wireless radio frequency radiation. The backstory that after World War II, the U.S. had developed a rather robust research program involving several U.S. agencies. In 1984, the Environmental Protection Agency released a report on the biological effects of electromagnetic fields. And actually, in the early 90s, the EPA was the recommended agency to develop human exposure limits. However, at the mid-90s was also when there was heavy lobbying for the Telecom Act. In fact, it was the most heavily lobbied bill at that time ever. And by the time it passed in 1996, the Environmental Protection Agency had been fully defunded from their work on electromagnetic fields. And that was a few months after actually they had presented to the FCC how they were developing safety limits that would be based on heating effect, as well as non-thermal, non-heating biological effects. But they were fully defunded from developing safety limits. In fact, we don't have federally developed safety limits. Those are adopted limits by the FCC. So in 2020, I wrote the Environmental Protection Agency about their opinion, and they responded. EPA's last review was in the 1984 document, which I referred to, the biological effects of radio radiation. And they also said that the EPA does not currently have a funded mandate for radio frequency radiation manners. And what about the World Health Organization? That's also been quoted as somehow providing safety assurances. There is a web page that says no adverse short or long-term health effects have been shown. However, that is not based on a review of the totality of the science. And in fact, there are two separate entities underneath the World Health Organization umbrella. One is the World Health Organization EMF project that drafted these online websites that everyone reads that we think provides safety assurances. And there are numerous published papers documenting the long-standing industry ties to the writers of these very web pages. And then there's a second entity, the International Agency for Research on Cancer, which classified radiofrequency radiation as a possible carcinogen back in 2011. These are two separate entities. Now, the International Agency for Research on Cancer has not convened their expert working group to make another determination based on the newest science, the animal studies and other human studies that have been published. So the WHO EMF project web pages are not official determinations. And actually, to just dive slightly even deeper, if you actually look at the WHO EMF site, you'll see that they haven't made any, done any reports since 1993. You can go to the list where they have their monographs and their reports, and 1993 is the last report on radio frequency radiation. There's a 2022 letter that was published in the Journal of the American Medical Association by Sage et al. And I'm bringing this up because I have heard statements to the committee that the majority of studies don't find effects. But what this publication, what this letter cites, that in fact the majority of the latest science does show effects. I'll just quote, the 261 studies looking at oxidative effects from radiofrequency radiation exposure, 240, or 91%, showed damage. Of the 346 studies on effects of radiofrequency radiation on genes, 224, 65%, reported genetic damage. Of the 336 studies published on radiofrequency neurological effects, 73% reported effects, and only 27% showed no effect. And there's a Switzerland Institute of the Environment expert review, which was published, that found increased oxidative stress in the majority of animal and cell studies with exposures within regulatory limits. So what federal agency has authority or is funding or studying cell tower radiation, making sure that the people and environment are protected? And the answer is none. There actually is no federal agency with any health or environment expertise that is ensuring safety, that's looking at the research, scientifically looking at the levels at which effects have been found in studies, evaluating the studies for their quality, and making a determination. Other countries, not the United States, they monitor the radio frequency levels. Some have real-time 5G monitoring stations. Some have monitors which are near schools or other vulnerable areas as they're defined. And they are writing in a public way. There's websites where you can look up what is the level here, what is the level there. In France, if you want to know what the level is in your community, you go to your mayor, you request a reading, and you can get that by law. And a lot of countries have it posted on websites. So when it comes to the ambient radiation from cell towers, we have a regulatory gap. And I am glad to answer questions. I guess I would like to end with this one quote from a letter that was published in the Journal of the National Cancer Institute. And the experts who published this letter, it's about a study that seemed to show safety, but actually the design of it was irrelevant to the way we use technology today and the way we're exposed today. The former director of the National Institutes of Environmental Health Sciences, Dr. Linda Birnbaum, Hugh Taylor, who's the chief of obstetrics at UNC Hospital, and Dr. Deborah Davis, and Professor Paul Benishai, and neurosurgeon Hillel Baldwin published this letter, which states, the majority of animal and cell studies have found non-ionizing radiofrequency radiation can induce oxidative stress, a key characteristic of human carcinogens, in a way that radiofrequency radiation can initiate or promote tumor development, as well as play a role in the development of other diseases. DNA damage and cancer in state-of-the-art studies signal the need for the public to reduce exposures to radiofrequency radiation now. And I'm glad to answer any questions as well. Thank you so much.